Senate Republicans are now planning to roll out an updated version of their bill to repeal and replace Obamacare by the end of this week. Bring it to a vote on the floor next week. Here's what Senate Majority Whip John Cornyn had to say about this timeline on Fox Business.
I would expect that we'll turn to it perhaps as early as Tuesday and Wednesday. We'll have on this type of bill, we'll have a vote-a-rama. In other words, there's unlimited amendments, so there'll be an opportunity for people to offer other suggestions and improvements perhaps on the floor of the Senate. But it's important we get this done and get it done soon. Next week is my expectation.
Meanwhile, senators returning to Capitol Hill after a week-long recess were greeted by health care protesters. They swarmed their offices. It comes as a major new survey finds that 2 million more Americans, mainly the young, became uninsured this year. Joining us right now is former acting CBO director, former Council of Economics advisor under Bush 43, and former chairman and CEO of Paine Webber. Don Marron is here. Don, good to see you. Thanks so much for joining us this morning.
Hey, pleasure to be here. Can't claim the Paine Webber connection, but all the other ones are true.
Oh, right, sure. That was actually the senior, Don Marron Sr. on the Paine Webber connection. You're right. Thank you, sir, for that. Republicans are aiming to have a new CBO report of their proposal by next week. Do you see that happening? Is this doable?
You know, I mean, it is if they settle on language, right? The challenge is that if what they're going to offer up keeps changing, the analysts at CBO have to keep analyzing it. They need time to do that. If the language settles by Thursday, we ought to be able to see something by early next week.
Why is this so complicated? I mean, I just don't understand the process, why we can't get something done. We're 8 years of promises of getting health care reform done. Shouldn't this be much more straightforward?
Well, I mean, it's straightforward rhetorically, but when you get into the practicalities of actually doing it, it's incredibly hard. The ACA expanded coverage to more than 20 million people. You're talking about proposals that would roll back much of that. The folks who've benefited from it are aware of it. They organized against it. People are sympathetic to that. And so making changes is really hard.
I just look at the CBO numbers, and the Democrats are really using those and saying, 24 million people are going to lose insurance. They're using all these. Isn't there another way to look at this, as if 24 million people might get more choice in their health decisions? Or, I mean, it seems that a lot of this is about how these results are being framed.
Well, so there's always a framing game with CBO analyses or anyone's analyses. I think when you look at the 22 or 23 million folks who would lose coverage under the House or Senate bill after 10 years, the majority of that is from Medicaid. In the Senate bill, it would be 15 million of those. For me, I think it's hard to frame that as a choice issue. I think that's really an issue about how generous we want our social safety net to be, and these proposals out there would make it less generous.
Well, I think this is a really important point. You say how generous it should be. Can we look at Medicaid for a moment and take a look at how it has expanded in the last several years? Is it really generous, or is it just including lots of people that really shouldn't be there?
Well, this is the great issue that people have, different views on, right? So the goal of the ACA was to expand it to folks who didn't have coverage before. The canonical example would be someone who was single, didn't have kids, was of low income, but not necessarily below the poverty line. 31 states have decided to take the federal government up on that and expand to them. 19 states have decided not to.
Don, I want to ask you about the CBO itself. There are a lot of people out there, including Mick Mulvaney, the OMB director, who wonder if the CBO should even exist. They argue that its forecasts are often, if not always, wrong on the budget, that these numbers are being spun on how many people will lose health care. What do you say to those people who have a problem with the CBO itself?
Right, so it will not surprise you to learn that I'm going to stand up strongly for CBO. I think it plays a vital role in our budget and fiscal policy discussions. You need someone out there who's going to do their best of level objective best to analyze what the implications of proposals are, to put some numbers on them so that people can understand the trade-offs that we face. If you didn't have CBO in that role, you'd be left at people speculating, making up things based on their political will. There always is this alternative that the executive branch has enormous resources. They could put out their analyses by their professional staff. We could see what they imply. But you'll notice that the executive branch has been loath to do that.
So what about the criticism then? What do you say to those who say, look, they're wrong often, it's more noise than anything else? How do you respond to the critics of the CBO then?
Well, you know, so as either Yogi Berra or Niels Bohr once said, prediction is difficult, especially about the future. You know, clearly the models are going to be wrong. Everyone should stipulate that up front. The question is whether they're useful. I think they're incredibly useful for helping frame the trade-offs, frame the issues that we face. You know, they make clear that if you want to save money by rolling back subsidies, folks are going to lose their health insurance. You can have a debate about whether that's appropriate, whether that's moral, but it's important that the trade-offs be laid out so that we can have an intelligent discussion of them.
So what about, let's talk about the issue of pensions, Don. A group of 25 Teamsters, they have pensions. They're meeting today with Treasury Secretary Steven Mnuchin about failing pension plans. What's the Treasury's role, do you think, when it comes to pensions?
Well, you know, I mean, the number one thing for Treasury is to understand what the issues are, to help start guiding the administration to think about what pension policies should be going forward. You know, I would note on that front that if you look out at state and local governments, they pose a much larger, widespread problem in coming years on this front. Clearly, there are some challenges in private plans like the Teamsters face today. But if you're looking ahead, which the administration ought to do, we really need to think more carefully about how we're going to fund the state and local pensions that have often been promised but not yet funded.
All right, we will do that. Don, thank you. Good to see you this morning. Thanks so much for weighing in.